Hello and welcome to HEALTHAFRIK on AAU TV. AAU TV is the voice of higher education in Africa. Today on HEALTHAFRIK, we are continuing with our men series. So last week we brought to you prostate disorders and it was super. This week we are discussing the male reproductive system, specifically erectile dysfunction. Yes, and it's going to be mega. That's why you shouldn't miss the conversation. And as always, I have Dr. James Acquah from the Medimosis Prostate Center here in Accra joining me here today for the discussion. So a lot of men have issues with their male reproductive system, but then they don't talk about it. That is because of issues like stigmatization and shame and fear and stuff like that. But then I believe that if you talk about it, that is when you get to know what you can do about it and get back on track. Because if your male system is not working, my dear, you're not going to get a girl. So please, if you're a girl or a boy watching me today, please stay with me. Let's have this conversation with Doctor and let's all learn and do better. My name is Bridget and today you can send in your questions to this number 054 143 2070. 054 143 0270. Please send in your questions and it will get answered. My name is Bridget Amadente. Do stay tuned. I'll be back shortly. You're welcome back from the break. As I said earlier, today we are continuing with the men's series and we are discussing erectile dysfunction. If you're watching today, you can follow us on Facebook, Association of African Universities, on YouTube, on Twitter, and on Instagram. Doc, you're welcome.
Thank you.
It's a pleasure to have you here again today.
Same here.
Yeah, as I said, last week was super. This week is going to be mega because it's erectile dysfunction. So I want us to go straight into talking about what is the male reproductive system.
Okay. So basically, the male reproductive system consists of the penis and then the testicles. Those are the two visible things we can see. But there are a lot of organs within there.
Okay.
For example, if you take the testicles, there are tubes that connect it.
Okay.
Where, like the sperm duct, that's where the sperms are released. We have the what you call the epididymis. The scrotum, that is the sac that we see. You know, there are some two balls inside. That is where actually the sperms are produced. Then they are released all the way to the sperm duct, and then it comes to the penis, and then the semen comes out. So the penis and then the testicles, those are the two main organs of reproduction for the men.
Okay.
But it all has its function.
Yeah.
Yes. So those are reproductive organs.
Okay.
You know, before when you give birth to a newborn, as they are developing, just like women, there are certain things in them, like the hormones. These are the hormones that help the male organ to develop.
Okay.
So after puberty, they say from the ages of 13, 14, 15, those days used to be maybe 17 years going, but now even young guys like 15, 16 years have started producing, though they produce semen, but sometimes they doesn't contain any sperm.
Okay.
But after 16, 17 going, then sperm start producing.
Okay.
So when the sperm start producing, then it changes their entire masculine nature. Now they start developing thicker bones, they start having the muscular body that you see, and then this kind of deep voice that you hear from the man. So the moment you start seeing those things, then you know that the male organ has or is developing or is completely developed.
Okay.
Yeah, so those are the things to know whether the male organ is fully matured or it is not matured.
It's not matured.
Yes. So basically, these are the organs for reproduction for the man. Yeah.
Okay. Okay. But what causes an erection?
Good. So before you have an erection, the brain has to activate a response. The brain will use the response to initiate the erection. the brain uses sight. So for men, what we see, or hearing, or feeling, or touch. So for example, if you go into the bedroom and you even close your eyes and your partner touches you, even without seeing the partner, you can get an erection because that is the signal that the brain will receive.
Okay.
So it's either you see, then the brain will send a message, or you touch something, the brain will send a message, or you hear. That's why people can have conversation on phone and still get an erection because of what they have heard.
Okay.
Yes, even without seeing any woman. So what you see, what you hear, what you touch, and what you feel. Sometimes I don't even need to see, hear, or touch anything. Just by imagination, feeling, putting yourself in the mood that, or in a sexual mood, the brain still can pick the message.
Okay.
So these are the initiation stage of getting an erection. Now, once the brain receives this information, it sends a signal to the penis. It sends some chemical signals. We call them their transmitters.
Yeah.
So they send the chemical signals to the blood vessels or the arteries in the penis and tell the penis that widen up. I mean the blood vessels widen up because you are coming to receive a load of blood.
Oh, okay.
Now, once the penis muscle or the arteries of the penis open up, the heart has to start pumping blood faster to be able to fill the new gap that is created there. Because ideally, let's say if the diameter of the arteries is, let's say, 1 millimeter, now it has expanded to about 1.5. So a lot of blood has to rush in there. Now the heart starts pumping enough blood. Now when the blood goes, it sends another signal that don't leave. Because normally when the heart pumps blood, all over, from the head to toe, it comes back to the heart, it pumps again. But this time on, because of the message the brain has sent to the penis, when the blood enters, it sends another signal that don't leave the penis.
Okay.
Because the moment it leaves the penis, the penis will become flat again. So there is a time period that the blood has to stay in the penis, and then the muscles of the penis enlarges. So that's why during an erection, there's an increase in size of the male organ.
Okay.
Now, so this is the period of where erection takes place. So before an erection takes place, a signal must be sent from the brain to the penis muscle, the blood vessels there to open up. The blood has to pump enough blood to the penis. It has to stay in for some time before finally it withdraws back after ejaculation. And then there's a process of ejaculation. So the erection is when the penis becomes harder or strengthened. Now there's an ejaculation. Ejaculation is when sperms are released, because mostly after ejaculation, then the penis goes down. Ejaculation means that the sperms have now moved from the testicle. So now it's up for the testicle to do its job.
Okay.
So once the erection comes, at a peak, when the intensity of arousal is high, then there's a contraction of muscles of the penis to squeeze the sperm, to release the sperm from the testicle to a place we call the seminal vesicle. They contain the semen.
Okay.
And then to the prostate. And then the muscles will squeeze. And then when it squeezes, less than every second, it has to contract and relax.
Okay.
So this releases the sperm outside. So it contracts, relaxes for some seconds. After all the content is released, then the blood that initially it was pulling automatically will now draw back. And then the penis becomes flatter. Until another signal is sent again. Then another erection takes place.
Okay, so if a signal is sent just after the sperm came out, it will still respond?
Yes, it has to still respond. But depending on numerous factors.
Like?
Because before the brain will send a signal, the brain itself must be working. That is number one. Because there are some people that even when there is a woman naked in front of them, they cannot get erection. Maybe they have a mental problem.
Okay.
So the brain must work.
Okay.
So that is the first stage. Now, your blood vessel must also work. So I was explaining to you the reason why people get erectile dysfunction when we get there.
Yeah.
Now your heart must also work because it's also going to pump blood.
Yeah.
Now your hormones, which will trigger all the receptors
Yeah.
to get you around, must also work. So these are complex mechanisms that any deficiency in any of them will give you an erectile problem.
Oh, so the hormones, the brain,
The brain, the heart, the blood vessels,
and the blood vessels.
they must all be working good.
If they are not,
if there's any defect in any of them, you won't get an erection, or you get a very poor erection.
wow. So all these four must work at the same time.
At the same
so
time.
if one is not working, you might get an erection, but it's not.
Yes, or it might not even work at all.
Wow. So okay. Okay. So now that you've talked about, I want to know some of the signs that someone will see.
Yeah.
Yeah, on them, that will know that, okay. No, even before that, you know, there's this morning wake-up call that they call that men normally say that normally in the morning they have their male organ rising up to show that, oh, okay, I'm still working, that kind of a thing.
Yeah.
Yeah.
Ideally, you should have it.
Okay.
But not having it, maybe you are not conscious of it. Not having it does not automatically mean that you have an erectile dysfunction.
Okay.
Because before you must get an erection, sustain it for some time. Because not like the blood can pull in, get the erection, but it can come out within 5 seconds. Though you've gotten it, but there's a problem. So one, you realize that there's loss of libido. The loss of libido is like now you don't even have that kind of brain signal to even get an erection. You don't feel for anything.
Okay.
So loss of libido. Secondly, lack of erection. And then the last one is inability to sustain the erection. So basically, these are the three classical signs you will know that you have an erectile dysfunction or not. So someone may be able to sustain an erection for a longer time, but if for the first instance you don't even have the feeling to even have a sexual intercourse, it's also a problem. Though if you try, you may be able to sustain, but you don't even have that sensation or feeling to go in for sexual intercourse. It's also a problem. People are like that. They don't have any. They're able to sustain erection, but for them to even have a feeling
erection.
To get an erection is a problem.
What if maybe they haven't discovered what makes them get an erection?
Yeah, so beginning I told
so
that
maybe
the
someone's own is sight. Maybe someone's own is what the person hears. Maybe someone's own is different. Maybe they just haven't discovered it.
Yes, but there's a common platform that
okay, it has to be this.
The sight is primary. The hearing, the touching, and then the imagination.
Yeah.
Yes, you can imagine it and get the erection. You can touch it. Those things are basic.
Okay.
If you don't have that, then you need to investigate. Because I will come to the causes, what might cause people not to have all this kind of thing.
Yeah.
Because it's not normal when you have to be in a room with your partner. Because ideally, science state that you have to have sexual intercourse at least twice a week.
At least twice a week.
So 4 times that is 8 times in a month.
Yeah.
Yes. And you have to have the strength to do that. So if you
So
don't do anything below that, you can be classified as having one way or the other an erectile dysfunction. Not necessarily you cannot erect, but you not even have the feeling to get the erection. It's also a problem.
So what causes this?
Yeah. So there are 2 major categories. We have the psychological part and then the medical or physical part. The psychological part can be issues with the family or issues with in the relationship. So for example, every day your wife is fighting you, maybe for basic responsibilities, school fees, feeding, and all that, psychologically, your brain will shut down. So you cannot see your wife and get an erection. Though you must see a side chick and get an erection. It's a problem.
Just because she's asking for money for the children, feeding and stuff like that, you just decide to shut down.
No, it's not decided though, because the brain is stressed on that partner. So that signal from the brain will not be sent to the penis to receive that blood for erection.
But when the brain sees another person, like
because
a side chick,
because the brain is not decoding that message of stress from the side chick.
Person. Oh. Okay.
You get it. So that's one of the psychological factors. Job problems.
Yeah.
People have not been paid for months.
Yeah.
People have been sacked. Automatically, the brain will know it's not going to send a signal for erection. No matter how you try, it won't work. Stress. You don't get enough time to rest. People work all the time. So as you are working, because it's the same brain doing other functions. You know, the brain performs almost about 99% of everything that we do.
Yeah.
For us to see, for us to even hear is the brain. If the brain is actively working on other substances or other projects, it's difficult for you to signal your penis to get an erection. So issues with job, issues with family, issues with stress, and people even have a medical, like a mental problem.
Yeah.
Like dementia, schizophrenia, and all those ones. When people are aging, they tend to lose part of their memory, and they cannot even recollect events and all that. Those things will not let the brain send a signal.
Oh, but even dementia, you can say maybe they are growing, so the libido is low and stuff like that. But then if you're not between those ages and you're like 40, 30, 50, and you say, okay, mental issues, stress and stuff like that, it's understandable. But dementia is a different.
No, but those ages, they also wish they were sexually active.
Oh, really?
I'm telling you.
70.
80, 90. Yes. People, they do come to our clinic all the time. Yes, 88, 85.
Hey.
Yeah. So it's not like it is their wish that it's where I've gotten to, it's okay, I'm tired. No. It's because of certain issues, they are not getting that kind of erection and they have decided to let it go.
Oh, I see.
Otherwise, if everything was okay, they would still be having intercourse.
Wow. 70.
Yeah.
80.
I say 80, 85, 90. Yeah. So things happen, like the brain degenerating, other conditions coming in and all that. So they don't. The issue is not they stopping, but they don't get it.
Yeah.
Yeah. It's not like they have decided to stop. No, they are not getting.
They're not getting
the erection. Yeah, because of these factors.
Wow. So we'll move on to the second. You said it was in two branches.
Two categories. So these are the psychological, mental part that will have people.
Yes.
And then you go to the medical or the physical things. People with diabetes. Yes, those with diabetes, high blood sugar. At the long run, it will affect their nerves and they will not get erection. Yes. People with high blood pressure. High blood pressure, when their BP rises.
Yeah.
Because I told you that the heart must be able to pump blood to the arteries of the penis, and they must sustain. For that's why during sexual arousal, the heart starts to beat more faster. When people fall in love, the heart starts to beat faster because there's an increased demand of blood supply. So when the heart is not in a good shape, like those with hypertension, erection will be very difficult.
Yeah.
And then there's something we call arteriosclerosis. That's when the arteries have become hardened because the blood vessels are a bit softer. They expand and then relax.
Okay.
When it's become hardened due to deposit of fat over a long period of time, now they cannot stretch and they cannot contract again. So blood moving through it becomes difficult. Sometimes it's even narrowed. So when it happens like that, blood cannot adequately move to the arteries of the penis to sustain an erection. So that is also a problem. Physical injury. So because the penis is a muscle controlled by a whole lot of nerves around, maybe through accidents, you get injury to your spinal cord, because you know the brain and the spinal cord, they control our central nervous system.
Exactly.
So if you get any injury to the spinal cord, then even initially the brain will not even send a signal. Yes, because the spinal cord contains all the communication, mechanism of the body. So when it's damaged, there will be no communication to the penis to even get an erection. Sometimes after surgery, maybe they have done a surgery to the manhood. In the process, certain nerves are damaged, certain blood vessels are damaged. It can also lead to erectile problem. Then we have issues with hormone. There's a hormone we call testosterone. That is the male hormone. It's the one that also gives us that kind of sensation, that kind of feeling that, oh, let me go and have an intercourse. Some people have low levels of that hormone. So it means that you might not be able to get too much erection. Yes, so these are some of the medical issues. And then even drugs. For example, long-term antihypertensive medication, medicine that you use to treat high blood pressure. Some of them, when you take it for a long time, the medicine itself also give you erectile dysfunction. So for hypertension, if you have the hypertension, it's a problem. The medication to correct that problem is also a problem. So most of the time, men don't like to take the antihypertensive medication just because of that reason. Yeah. That is why we die early, we get stroke early. Look at the men having stroke, and look, because we are not taking our medication. The women take it because more or less it doesn't have too much effect on them. But the men, once they take, after some time, they cannot get erection again. So they don't like to take it. And through that, you get stroke, heart attack, and then that's it.
So I mean, which one would you prefer? To live and not have an erection, or to get stroke and die?
Oh, people too prefer to die. For living and not having it, it's a stress.
Doc, we are going on a break, and when we come back, the questions that are coming in are mega. People are asking about Viagra, infertility, hardening of the penis and stuff like that. Please, yes, that's what they are interested in, and they are coming from nice girls. Please stay with me. I'll be back shortly. You're welcome back. We are still discussing erectile dysfunction. Doc, so my first question that is coming from someone is the use of Viagra as treatment, and then the use of Viagra to stimulate, sexual senses and everything like that. What are some of the effects of using a Viagra first? And how is it used?
The positive effects or the negative?
Both.
Both of them. Yeah. Viagra, I told you that Viagra, it works by when blood gets to the penis. Instead of the blood coming back after some time, the Viagra stops the blood from coming back. So it makes the blood stays in the penis for a long minute or hours. That is the way it works. So they prevent blood from moving back from the penis. Yes. So Viagra wouldn't work if you don't get, for Viagra, you have to get an erection first.
On your own?
On your own. Then
I thought it will give you an erection.
No, it's separately won't give you an erection. But when you get an erection, the blood rushes in there. Then it will prevent the blood from coming back quickly.
Okay.
then it stays in for long.
Okay.
So that is what Viagra does. So people are okay when they take it, they're able to sustain erection for a longer time. But the blood also staying in for a longer time can also be a problem.
Yeah.
Have you heard what you call priapism? It's when blood moves to sustain erection that never flattens.
Yeah.
So blood stays in there, and sometimes, unfortunately, if you're not careful, it doesn't even come back. So then sometimes it can be emergency because you have to rush people to the hospital and then manually take the blood from it before the penis fall down. So it can cause that. And then because now you are allowing the heart to continuously pump blood more than the usual, because now you are telling the heart that instead of maybe those days 5 minutes without the medication for the heart to continue to pump, because you are taking the Viagra, now the heart has to pump for 30 minutes. So the heart has to have that kind of strength to be able to do that. So imagine you having a heart problem and then taking Viagra. You might let the heart pump and then you get heart attack and die. It happens all the time. You get it? So these are some of the side effects of using Viagra because it makes the heart pump too much. So mostly those with heart diseases, they need to talk to their doctor before they take Viagra.
Okay.
How would you even know that you have a heart disease?
Yeah.
That is the problem.
Yeah.
So to be able to, that's why I'm saying you have to talk to your doctor. He might screen you and to know whether you're not hypertensive, you don't have any peculiar heart problem before he starts putting you on. But taking Viagra
so it's even prescribed for people to buy Viagra?
Viagra is prescribed. Oh, it's prescribed. It's not illegal. It's prescribed. I mean, it is used medically for treating this kind of erectile dysfunction or erectile problems.
Okay. And then the other Viagra, you've talked about the Viagra that you take in as in a tablet.
That's a pill.
The pill. And then the one that they spray on the male organ.
There are so many of them.
There are so many of them.
There's always not one. There are so many of them.
Really?
Different brands. Some are even cream that they apply. What that does is numb the place. It reduces sensation of the nerves there, and they believe that once the sensation is reduced, they're able to sustain erection. So that works differently from the Viagra. Viagra will prevent blood from coming out, but the spray will numb the place and reduce sensation of the penis muscle or the tip of the penis. And then once sensation is reduced, they're able to sustain erection for a longer time. So that is an external use. That's how they work. Yeah.
And then when you spray and you don't use, let's say, a condom and you have sex, putting the whole, like the spray or the cream that is around your penis in the vagina of a woman.
Yeah.
Won't it lead to complications for the woman?
So
maybe some rashes or something?
So many complications because the woman might react with the chemicals in the spray. Yeah, so it's also not used. It's also used under the guidance of how do you call it, a medical practitioner. Yes, but people use it indiscriminately. No doctor will recommend that. But people find ways of getting it and use it. It is not good because over time you reduce sensation to the penis, and then you might not even have a sexual how do you call it. You must not even have that kind of enjoyment like you used to have it because you overuse it. Yes, they have, and then they have an addictive way. Like once you use it all the time, you must be able to use it, which is a problem. Yeah, it must also not be used unless maybe a doctor, which I doubt because there are many options safer to choose, unless a doctor recommend.
Okay.
Yeah.
I was about to ask something, but it has just escaped me. So we'll move on to another question that just came. Says, when people have noticed that when a man is hard, the color of the penis changes. Is it normal or it has got to do with some health issue? Let's say the tip
of the penis change, it becomes more reddened.
Exactly.
Yeah, because I told you a lot of blood has moved in now.
Oh, okay. So it's the blood that has
the blood
moved
that has moved that
in.
changes the color.
Okay, so it's not any health issue. No, it's not any health.
No, it's not a problem. After ejaculation, it should come back normal.
To normal.
I think those who are light color, maybe they see this. I don't think some of us we even know that. Maybe the light colored guy, or maybe the white, whatever you call them, the Caucasians, maybe they will see that kind of change.
Okay.
Yeah, but it's the increase in blood flow to the penis that causes the color change. But it's normal.
Okay. The thing that escaped me was the use of Viagra and the number of minutes you can have an intercourse. So if maybe you're a man and then your usual number of minutes is like 5 to 10 minutes,
Yeah.
the Viagra will make you go 30 minutes.
Exactly.
Or 1 hour.
Yes. So normally we classify that for the first round of sex. What people used to call the first round.
I see.
It should last up to about 5 minutes.
Why?
Between 5 to 7 minutes. That is the, it is a research done all over the world. The first one should last between 5 to 7 minutes.
Okay.
If there is a second round, that is about 10 to 15 minutes.
Hey.
Yes, and then if there is a third round, 25 minutes upwards. So anything below 5 minutes, it will be considered as a premature ejaculation or an erectile dysfunction for the first one.
Okay.
Yes.
Okay.
And even after that, you must be able to still sustain an erection.
So, okay.
Or get an erection within some few minutes.
Okay.
Yes.
Okay.
So the issue is about getting an erection and then sustaining it. Yeah.
So the continuous use of a Viagra, can it lead to infertility?
No.
It can't?
It can't.
Looking at all the negative effects?
No, it can't.
Really? So you can use it for life?
Oh, well, it's choices.
Hey!
Because it's expensive though.
It's expensive.
Yes, because the compound in Viagra is sildenafil. That is the compound in it. A lot of companies produce sildenafil, but one of them is Viagra. So actually, the Viagra is a brand, but there are a lot of them at the market doing the same thing.
Okay.
But then that's what I'm saying, that it must be used under the guidance by a doctor.
Okay.
That will be okay. But it shouldn't be abused, because you might not know when you have a heart problem. And I don't think you can be using that every time. Yeah.
Okay.
It's better to look for the underlying cause.
What of tramadol? Tramadol, will it qualify as a Viagra?
No.
It won't?
It won't. But the abuse of tramadol, that is why people try to abuse it, because normally the original dose for tramadol is about 50 mg. That's 50 milligrams. It's a good medicine for pain and all that, for fevers but when you take it in large quantities, when you abuse it in that quantity, it makes you hallucinate, like kind of
You're seeing stars.
You are seeing stuff, you are hearing stuff, it makes you energetic. So that kind of feeling that they get.
Oh, I see.
Yes, that kind of feeling that they get. So for example, someone who has a problem with their wife at home, and the person is going to take large doses of tramadol, he might not even remember the problem. So he will come and still perform, but maybe under another circumstance, if you have not taken any medication, that kind of problem will still come back and you might not get the erection.
Okay.
So in effect, you might think that it is tramadol helping you to have the sexual intercourse, but it is not.
Okay.
The state of mind.
The last question here is when you know there are instances where we hear of someone's penis getting stuck in a woman's vagina. What causes this?
Those stories, I've also heard it too.
So they are just stories?
I think so.
Because
I have not seen any.
You haven't seen? But what will cause someone's penis to get stuck in a vagina?
Well, the vagina will have to be lubricated before sexual intercourse.
Exactly.
So I doubt anything was stuck. But if anything, maybe along the line, there is dryness. And then there's an increase, because when the blood keeps pushing inside the penis, it's going to expand. So there was dryness, and then there was an abnormal expansion of the penis.
And now it can't come out.
It can't come out, weirdly. But I also hear those stories, honestly.
Okay, so when that happens, let's just say that happens to a girlfriend and a boyfriend. They're not even married. What should they do to get out of it?
No, you have to go to the hospital.
Go to the hospital like that?
Yes.
Hey!
Otherwise, you might lose your penis, because if the blood stays in for too long, it starts to clot. And then if you're not careful, it will destroy it. You might not even get an erection again. And then the penis will start dying. So you must immediately go to the hospital. There's a way we can tap the blood direct from it, and then it comes down. Then whatever, if it has stuck, it will come out.
So there's no like home remedy you can do?
There's no home remedy. If it is that thing you are saying, if it is true, then there will be no be home. I know of the priapism where the penis will erect and it never
goes
down. Yes, that is there, but that's also an emergency. But people haven't stuck. In fact, I haven't seen. If any have seen, I wish if they have videos, probably they should send me. Then I will see what happens. But I've also heard.
But going to the hospital is a very, because they are naked, and how are you going to clothe yourself and go to the hospital and say, okay, we are stuck, like we want to come out of each other?
It's painful. At the point of death, you don't you don't have to be thinking about whether you are naked or not. If you die, you'll still be naked anyway. So you have to take all pride and then rush to the hospital. Yeah.
Okay. Okay. So now let's come to some diets or exercises that one can do to prevent getting into the situation of erectile dysfunction. Is there any particular food that someone should be eating or exercise routines to help?
Yeah. One of the causes of this problem is stress. So exercise will be much helpful for those that are too much stressed. Then we have a sedentary lifestyle. People wake up, they sit in their car, go to sit in the office, sit in their car again, go and sit in their home and sleep. They do that almost the whole year. That is a sedentary lifestyle. It will make you put on weight. And then the more you put on weight, you are prone to having this kind of metabolic diseases like diabetes, blood pressure, obesity, high cholesterol.
Exactly.
And the moment the cholesterol goes high and all that, it blocks you and then you cannot get good erection. So exercise is number one to reduce stress and at least to burn down calories so that you keep your healthy weight. Diet, time of eating, not only the food, time of eating. There is an amount of food that the body needs every day. If you exceed that one, the body will store it as fat and put it in our tummy. So that's why when people start putting on weight, the tummy is the first thing that starts coming out because that's where the fat tissues are. So whatever food that the body doesn't use, at the end of the day, it converts to fat and store. Over the years, if this fat keep piling up, then it leads to obesity and then it leads to all this kind of diseases. Yes, so you have to make sure that you eat as early as possible before 5 p.m. That is the last meal of the day. You don't skip breakfast, you take your lunch so that you maintain a healthy weight by exercising and then eat a lot of vegetables and fruits. Because they have the vitamins, they have the minerals.
Okay.
Yes.
Okay, but talking of the storage of fat, I know people whose fats don't go to their stomachs. It goes to other parts. Like for a woman, maybe it's going to her hips, her butt, her legs, and stuff like that. I know she eats a lot, but then her stomach is as flat as anything. She doesn't work out. She doesn't do anything. Just that the fat seems to go to right places, as we call it.
You think it's fat and not muscles?
Well,
because
no.
Well, fat redistributed, but the body has its way, or everybody has the way their fat is being redistributed.
Okay.
Some women need to distribute in their breasts. So those having huge breasts is fatty.
I see.
Some of them redistribute in their hips. Some of them redistribute in their tummies. Some of them their thighs and all that. But that you don't have much control. I think that is how she is naturally is. She has not programmed it to go to that part. Even though you see videos online, a lot of training on how to redistribute your body fat to where you want it. There's less evidence on that. So it's a bit of genetic, there's a genetic role in it, how fat should be redistributed. But some of them too are muscles, not necessarily fat like you see. And because the fat tissues are in the belly here. So when you are putting on weight, that's where it will always start. Then it spread to all other parts of the body. Yeah, so reducing fat will reduce, obesity. And then at least you keep you in a healthy weight.
Okay, so still talking about erectile dysfunction, is it genetically related? Maybe from your father to you?
It's not genetically related, but it can be congenital. Congenital means that you can be born with it. It's not genetic. You usually inherit it.
Yeah.
But maybe in the womb,
Okay.
In the process of forming your male reproductive organ, certain things doesn't mix well. So you are born and that child might never get an erection.
And nothing can be done about it.
Oh, now there are a lot of surgeries to do. Yes, there are a lot of ways. Some of them are very expensive. They have to do a restructuring of the penis, putting at there are times that you can even put in artificial pumps in the penis where when you press, it erases the penis. So the time you don't want, and then even I think Ghana here, some hospitals do some.
Really?
So even those that are 80 years can go. They put that in there. When you're ready for sex, you press it. It's erectile to the time you don't want it. You losing it and all that. So I think quite expensive anyway. This is the first time hearing it. It's there. It's
Wow.
there. Yeah.
Oh, okay.
It's there. So,
okay. Now let's talk about the treatment options.
Yes. So depending on the underlying cause. So for example, if yours is about family issues, then that family issues need to be solved by seeing maybe a marriage counselor or psychologist or something to talk to you. And then if it is caused by an underlying disease like diabetes. So mostly what we do is that if you have diabetes and you have erectile dysfunction, we recommend that let us stabilize the sugar for a period of time, and naturally the erection will start coming. But most of the time they reject it.
Okay.
They want you to do both at the same time, which it doesn't work that way. So if you have diabetes, you have to make sure you stabilize the sugar level. If you have blood pressure, you have to make sure that you stabilize the BP. And when you do all those things, naturally the penis starts to grow. And even those with prostate problems, when you have an underlying prostate condition, it can also lead. So those with that one, we have to also treat it for them. And then they get their regimen. So most of the time, investigation testing will depend on what we suspect. Okay. So that we can treat the underlying cause before. If it is a hormone, sometimes we do hormone therapy. Yeah, but if it is testosterone which is low, there's medicine that you take to increase your testosterone level. Yeah, we give it to you. And we have even direct testosterone injections and all that. Wow. If you go to America, there are some testosterone that you can even apply it as your deodorant. So some men, they make like a roll-on. So in the morning you apply here, and then testosterone goes to your blood, and then I don't think it's here now. Wow. Yeah. Some even it's even a spray. Sometimes you can even spray on certain parts of your skin to increase your testosterone level, and most of the time it helps. Okay. So treatment will depend on the underlying causes. Okay. Yeah. Okay. If it is cholesterol, high cholesterol, we give cholesterol medication. Yes.
Wow. So it's definitely not a lifelong disease.
No, it's not a lifelong disease. It's not a lifelong there is a lot of ways out, ranging from a minor to surgical.
Yeah. Okay. Yes. So your final words.
Even at times, the blood vessels to your penis can be blocked. So blood will not enter. And that will also make you not get an erection. There is a lot of treatment options for people with erectile dysfunction. It has created a whole lot of problems in the families. And most of the time, when people are going to marry, this is not part of the test they do.
Oh, really?
Like the pastor will tell you to go and check from the doctor whether your penis is working. They don't do that.
So when they say go for a test, I thought it was like
their
focus,
focus is on the infectious diseases, HIV, hepatitis B, syphilis, and gonorrhea, and pregnancy. We keep telling them that should not be the focus. Okay. Though those things are minor. Right. The focus should be issues, because if you have gonorrhea or whatever, we can treat. If you have hepatitis B, it's manageable. If one partner has, the other partner has to go and take a vaccine. But there are conditions that is a lifelong. So after marriage, a lot of them come. After marriage, the man doesn't get erection. In the first week of marriage, or even at the honeymoon. So what will they do? Are you going to divorce in the first week or two? You have to stay. Whom are you even going to tell your partners penis is not working? So it's a thing that we have to talk about it. You don't have to feel shy. Some men have it. They don't want to tell their partners. So their partners request for sexual intercourse, then they give excuses. You see in movies, it is true. You get it, they give excuses because they know that even if they try, it will not work. Some of them have not been married, because they know that if they go and marry with this problem, the marriage will not work.
Yeah.
But there is an option. There is a solution. There are a lot of range of medication that we can use to help them. They shouldn't feel shy about it. Yes, they shouldn't feel shy about it. They should talk to a male doctor. Maybe they feel shy.
Yeah, exactly.
Yes, they should
Sometimes
talk.
you want to go to the hospital, but you want to talk to a male doctor, not a female, and tell her that your penis is not working or stuff.
Even
like
the
that.
women don't want to talk to female doctors.
Oh yes.
Why?
That one, yeah. That one,
So
yeah.
I mean, they shouldn't feel shy about it. They should boldly go to the hospital and talk to their doctor that this is what, and they should be truthful about it. Yes, so that the doctor can really know the history.
Yeah.
Because if all your life you've not gotten an erection, then the cause is something different. So the doctor will know where to start the investigation. People come and don't tell even the truth. Especially when they even come with their partner. Hey, so when I'm married. But all you know, it's even started before they even got married. But they don't. So they should be honest about it. Give all the history, the background, so that you know the treatment option to give.
But how will you even test if a man is potent
Oh,
enough?
we test.
With what?
Oh, sometimes now
Is it
I think
physical therapy?
yes, now
so
I think
maybe
we have stopped. If you come and we say you don't get erection, we take you to a room to give you a fine nurse, and then we let the nurse try to.
A nurse?
Yeah.
Why not your wife?
No, I mean at the hospital. No, your wife, probably you and your wife have a problem. You know, I told you about the family. So we give you a fine nurse. We tell the nurse, take the person to the washroom and go and test and let's see. So you remove yourself and the nurse will start holding it. If it doesn't erect, then that's a problem. Yeah, we do. Yeah. It's part of the job. But nurses put on catheter, they hold the penis and fix catheter. So what is the big deal holding the penis?
It's not a big deal, but this is someone's husband. You are testing.
But now you have a problem, you have come. So we are giving you our solution.
Wow.
So some nurses do it. You take washroom. But see, you can't do it. I mean, it's professional.
Yeah.
So that's something you want to see whether what you are saying is true.
It's true.
So if after the nurse stimulating your penis and it doesn't erect, then you have a real problem.
Oh. Okay.
But most time when they go, the erection comes. Then you tell that look, it's your mind. Yeah.
Sunday. Final words. Let's close.
So men should be bold about it, talk about it, discuss with their partners, and then the women should also not intimidate the husbands. If they tell you that I have an erectile problem, please help the person to solve it. It's not like you insult the person, you are 1 minute man, you are 2 minutes man. Those things, reduce the man's self-esteem, and then they go in to take a whole lot of alcoholic bitters, which in the long run also even cause sexual erectile dysfunction. Yeah. So they should be bold about it, and then it has a solution. That is a good thing. Yeah, there's a solution to erectile dysfunction. Yeah. So I think that's what I would say. Bold about it, be honest about it, talk about it, discuss it, and then see your doctor for help.
Okay. Thank you so much. I've had a great time today. I've been laughing all through. Doctor says it's not a lifelong condition. Be bold about it. Go to the hospital. They'll give you a fine nurse, and then you will check. The nurse will stimulate and do stuff like that. And then they know what is wrong. Then you get treatment. That is why you should keep watching Health Africa on AAU TV. My name is Bridget Amadente. I'll see you next week.